Alrighty, hello and thank you for taking the time to hear this important message. My name is Austin Harbo, and today I'll be talking about the advocacy for urgent action to address one of the most serious problems in healthcare, specifically nurse burnout and mental health decline. This issue affects nurses, patients, and every single part of the healthcare system. Nurse burnout is not simply being tired. It's emotional exhaustion, it's mental fatigue, and physical strain caused by constant stress and overwhelming workloads. Research shows nearly 1 in 3 nurses experience burnout symptoms, and almost 20% consider leaving the profession altogether. During COVID-19, over 60% of nurses reported emotional exhaustion or anxiety. When burnout rises, patient safety falls. Burnout increases medical errors, reduces patient satisfaction, and threatens the sustainability of healthcare organizations as a whole. Hospitals spend tens of thousands of dollars to replace every single nurse who leaves, and the ongoing shortage is pushing remaining nurses to the brink. The issue requires strong legislation support. 2 key policies already exist, but they must be strengthened and expanded. First is the Safe Staffing for Nurse and Patient Safety Act, which would set safe federal nurse-to-patient ratios. Safe staffing saves lives, it reduces workload, prevents burnout, and ensures nurses have enough time to care for patients safely. Second is the Dr. Lorna Breen Health Care Provider Protection Act, which funds mental health research resources and suicide prevention programs for healthcare workers. This legislation acknowledges a sad reality. Nurses are struggling, and many don't have access to mental health support. Both of these laws are powerful steps forward, but they need continuing funding and enforcement and political support in order to broaden their horizons and create actual meaningful change in the future. Patients are affected because burnout increases the risk of errors, delays in care, and poor communication. Nurses are specifically affected by emotional, physical, and financial strain. Hospitals face the economic burden of turnover, training costs, and reduced staff morale. And then politically, this simply is a bipartisan issue. Everyone needs safe healthcare, so supporting nurses improves patient outcomes, strengthens hospitals, and protects the overall stability of the healthcare system. Now, this is what I have personally seen. As a nursing student, I have seen burnout firsthand in nearly every single clinical setting I have worked in. Nurses caring for patients while juggling immense stress, overwhelming assignments, and emotional pressure still push forward each and every single day. Many tell me about their anxiety, their fatigue, and their fear of making mistakes because they're stretched too thin. But I've seen what happens in environments that prioritize mental health. Nurses support each other, feel valued, and provide excellent care. My capstone, for example, was a great environment for mental health. The nurses were very supportive of each other. If a situation happened on the unit and the nurse needed a break, they would call another nurse over from another unit to cover for a short period of time in order to assist with any work that other nurse needed to take a step back or needed to take a break from. It was really, really awesome to see how well a well put together system of nurses and supervisors that truly care can help every single nurse there. And in the long run, this helped every nurse stay there more and work better because of how well they felt they were treated. Now, specifically, this is what I'm asking for Congress. I'm asking Congress to strengthen and support legislation that protects nurses, including safe staffing ratios, mental health programs, and funding for workplace improvements. By supporting these changes, we protect nurses and ensure better care for every single patient. Nurses are simply the backbone of healthcare. If we fail to protect them, we fail to protect the entire system. Thank you so much for the support, and I am excited to see the meaningful change that we gather in the future. Thank you.